concern is that a highly contagious disease such as measles could be introduced into a school that doesn't have a high immunization rate, that has a high exemption rate, and students could become sick and it could cause an outbreak.
Oregon schools reporting the highest rate ever for kindergartners claiming non-medical vaccination exemptions.
Statewide, 8.8% of kindergartners had a non-medical exemption to one or more of the required vaccines, which was up from 8.1% last year.
These exemptions are granted to families who oppose vaccines, whether through personal choice or religious beliefs. Exemptions may also be given to those who don't have access to vaccine services or to those who need more time to catch up on their vaccinations without putting their kids in jeopardy of missing school time.
Parents need to get a little bit of education prior to claiming that. And that can consist of watching an online video from the Oregon Health Authority or consultation with a healthcare practitioner that covers the benefits and risks of vaccination and the diseases that those vaccines prevent.
Central Oregon is also seeing that trend. In 2022, 6.9% of Ben LaPine kindergartners were non-medically exempt from vaccinations. In 2024, that number jumped up to 9%.
We're always concerned about public health in our schools and the possibility of transmission of preventable diseases. So we are keeping a close eye on that data.
Scott Mabin with Ben LaPine Schools says nurses actively work with families who are behind on their vaccination requirements.
We'll work with them to explain exactly what is needed, and then we share resources on where in the community they can go to connect their children with those needed vaccines.
OHA's data only includes school-required vaccines such as immunizations against measles and polio. The COVID vaccine is not required for school attendance, so those numbers are not included in the data. In Bend, Colby Anabrad, Central Oregon Daily News.